Recovery after breast asymmetry correction is really going to depend on what procedure or procedures were needed to kind of help correct that asymmetry. A lot of times if it involves a breast implant, whether it be on one side or both, there can be kind of some restrictions where I typically recommend the patient not really move around their shoulders very much for a couple of weeks, whether if a breast lift is done. In those cases, I don't want patients really stretching toward the ceiling or really moving around a ton with their arms and really pulling or tugging at the surgical incisions where those may be made. Again, it really just sort of depends on what procedures are done. I usually do recommend a surgical bra just for some support, at least for around 6 weeks after surgery. And in cases with a breast augmentation implant, usually quite a bit longer than that. How long will it take to see a result from a breast asymmetry correction procedure? Again, it sort of really just depends on what is needed at the time of surgery. Typically, breast augmentation with the implant will take a few months for the implant to kind of settle, for patients to really see the kind of the result that they're looking for. Even a breast lift or breast reduction, sometimes there's an exaggerated amount of fullness on the upper part of the breast that over the course of a few months, that kind of relaxes. The bottom part of the breast will kind of like round out and balloon out a little bit, like a much more natural kind of appearance. Majority of the time, I would say probably roughly 3 to 4 months for patients to see kind of the results they're looking for.